If everybody's ready, we'll go ahead and get started. And first, I'd like to welcome everybody here for our December meeting of El Paso County Board of Health. And I hope everyone had a nice Thanksgiving and is looking forward to a Merry Christmas. With that, we'll go ahead and do the roll call. And I'll call it out. So I'm here. Vice President Doris Ralston.
Here.
County Commissioner Carrie Geithner. Here. Commissioner Lauren Nelson.
Here.
Okay, and Mayor Todd Dixon, he and I have spoken. He's at PPACG, but when we get to the portion where we vote for president and vice president, we'll pause for a minute. He'll join by teams, and he'll be online, and then he'll vote also. He'll hear us speak, and then he'll vote. Hunter Barnett.
Here.
Dr. Chan. Where'd Dr. Chan go? I know she's here, so she's here. She's present. Courtney Salt.
Here.
And Dr. Vu. Okay, very good. The next item is approval of the agenda. Are there any corrections? Well, are there any changes to the agenda? If not, I'd ask for a motion in a second.
I move to approve the agenda.
Okay, thank you.
I second to
Okay.
approve the agenda.
All right, and second by Vice President Ralston. The motion was made by Courtney Salt. And then third item is the Board of Health comments, and I'd like to start that off today. At the city, we received this news release from CSPD about basically a more potent form of fentanyl, 100 times more potent. And I think we have a picture we can put up on this. I'm not sure who's running. Oh, it is. It is. Okay, thank you. And so I'll read just a little bit of this, and then if anyone else has a comment, great. And if not, we'll just go on with other comments. But so CSPD issued a public safety alert as overdoses linked to carfentanil, which is 100 times deadlier than fentanyl, rise in Colorado Springs. And so carfentanil is an incredibly potent synthetic opioid. It's known to be 100 times stronger than its well-known counterpart, fentanyl. Requires a minuscule dose of just 0.02 milligrams to potentially cause death compared to the full 2 milligrams that can be lethal for fentanyl. And as of November 12, 2025, Colorado Springs Police Department has recorded 61 fatal drug overdose cases. So these are fatal ones, drug overdoses this year, with fentanyl or carfentanil identified as contributing factors in 29 of them. And then the next paragraph goes over that the narcotics unit have seized over 700,000 fentanyl pills in 2025. Since September of this year, nearly 28,000 of them have this new substance, carfentanil, in them. And then the only other thing I think is worth pointing out is a large portion of these seizures have featured the substance in the form of M30 tablets, which are those little green pills in those bags on the slides. And they're often misleading as they resemble legitimate prescription medications. However, law enforcement has also encountered carfentanil in powdered form, which is typically white. Of these recent seizures, the department has seen a variety of mixed compounds, including the combination of fentanyl and carfentanil. And so I guess the bottom line is if you didn't receive the prescription yourself from a doctor or you didn't buy it yourself at a pharmacy, don't use it. Don't accept it from anyone else. And I don't know if any other board members have anything to add. Nope. Yes, Commissioner Geithner.
Yeah, I'll just say thank you for bringing this up. This has been a topic at the Opioid Council for the last couple of months as well, because the coroner was saying, increased usage of this and contributing to deaths as well. And I think I brought this up before, but just as a reminder, the Opioid Council is contracting with a wastewater analysis company, and I know Deanne or one of her staff members has been at these meetings. I think it's something that we can utilize here is they will be taking wastewater samples and then giving what is the proliferation of these things. And carfentanil is one of the things that they are testing for and are seeing in the wastewater system, obviously. Similarly, we're seeing that those busts are happening. And so I just think that there's a opportunity for us to think about how we can impact this and also work together with the Opioid Council. And we have kind of that metric in the wastewater that's being utilized.
Yeah. And I would just add for students, for kids, anything that a friend gives you and tells you it'll help with anything, it'll keep you awake in class or help you sleep, don't take it. It's just too dangerous today. It's just too dangerous.
I think one of the things that's been frustrating to me over working with the Opioid Council is we have a lot of nonprofits and a lot of agencies who will talk about just reducing use or safe drug use. That's really dangerous at this time. There is no safe drug use right now, ever really, in my opinion, but especially right now as these things rapidly change. So I agree with you. There needs to be a push to go back to not just, hey, do less drugs, which is a really, in my opinion, terrible place that some of our nonprofits have gone, and really emphasize how important it is to truly get help and abstain from any drug use.
And this was covered on the news channels. I saw it on television also. So hopefully the message gets out. We'll do our part that we can. But I'll go around the room just to make sure there's nobody else with any kind of comments. Dr. Vu, anything from you?
I guess I don't have any major comments. I just remember many years ago when I was in school, the saying was just say no. So
It's the only
that
real
was many
safe thing
years
to do.
ago, so.
Yeah. Courtney? No. Commissioner Geithner, anything else? Hunter, Vice President Ralston.
I'd just like to thank the El Paso County Public Health staff for all the work that you do. Here we're in the month of December, coming to a close of the year, and we have the Christmas and holiday coming up, and I just want to wish you a warm, safe, healthy, happy, and joyous holiday season, however you celebrate it, and just know that we thank you and on behalf of the citizens of El Paso County.
Very, very well said, Doris, and the rest of the board echoes those thoughts. Dr. Jan?
I just have a question for Commissioner Geithner and Director Ryberg in relation to the wastewater study. With the wastewater study, is it going to be possible to identify regionally within the county which areas might have higher rates of finding the metabolites of these substances? Or is it just going to be kind of a general study that is made at one point where you can't really identify where it's coming from?
I'd be happy to speak to that and welcome any additions you have. So my understanding is that there will be contracted services that are ongoing that will establish a baseline and will have a sampling framework. So it won't be from every location, but there will be a sampling framework, ongoing surveillance efforts, and an ability to monitor over time that will help inform trend changes over time. And of course, it will be based in municipal systems, so there will be gaps within the county based on sampling from municipal systems.
Yeah, I think initially we chose 4 locations, I think. So you've got the Opioid Council is a regional effort. And so you have some that are going to happen up in the Teller County area, and then some that will happen with CSU. So it won't be super location specific at this point. There is some talk about how much further we might want to go with that, because we do have municipal type systems in water districts across the more unincorporated parts of the county. So there could be more effort to diversify. Like I said, this is kind of like the initial, hey, let's start with 4 locations. So I think that will develop as we utilize that information, and there's a possibility of determining which areas have different amounts of use. But it's a little more difficult with CSU and President Donaldson could speak more to probably that, but it's a little more difficult with CSU because so much of what they have empties into a same location. But there was some talk about even, hey, we can pipe down into the system at any kind of location and drill down to that data potentially. So I think we're just in the beginning of that and exploring what the possibilities are. And again, I think public health can be very key in helping to share what would be valuable from our perspective as well as the Opioid Council moves forward. I can't remember what the cost is, but it obviously increases with every location. And so that's why we kind of started with 4. We had some on the board who are more skeptical than others on whether or not there's a lot of value in it. I think having objective data is valuable so that we can say, if we're running a huge campaign that is related to specific substances, we can say, hey, did the campaign have any effect? We spent $500,000 on trying to inform the public. Did it matter, right? That kind of a thing. But I think that a lot of that is to be determined, and I think public health's weighing in on that will be valuable moving forward.
I think it's a reasonable action to take in terms of seeing the impact of any interventional programs. But I also think that it would be helpful in targeting populations that might potentially have higher risk of use. And also it, I think, serves as a surveillance if areas shift, if you see use beginning to spread or moving from one area to another. So I definitely applaud the two of you on being proactive in that.
And thank you, Dr. Chan and Commissioner Nelson. Okay. And again, Todd Dixon will be with us a little bit later. Next item up is the approval of the minutes. If there are no corrections to the minutes, I'd ask for a motion and a second for that.
Move approval of the minutes.
I'll second.
Okay, so motion by Commissioner Geithner and a second by Board Member Barnett. And, I guess we need to vote on that too. So all those in favor, please say aye.
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 Any opposed? Okay, so that passes unanimously. Next up is public comments. And Amanda, do we have anybody signed up today for comments from the public? Okay. And just last chance, anyone in the room? And I don't see anyone online. So we'll go on to item number 6. And that will cover a couple of resolutions. And we won't read the resolutions out loud. But the first one is the Sunshine Resolution. Deanne, do you want to say just a couple words what this covers, the Sunshine Resolution?
Certainly happy to. Our Sunshine Resolution is in your packet, and this pertains to our public meetings that identifies our official place of posting for public notices, identifies where that information can be found, and that Public Health serves as the secretary for the board and is the official custodian of minutes of the Board of Health meeting, just making available to the public the parameters of our approach to open meetings.
Okay, and if, are there any questions from board members on that? If not, I'd ask for a motion and a second, and we'll vote on that.
So moved.
Who wants it? Okay, so we have a motion by Commissioner Geithner.
Second by Doris Ralston.
Okay, and a second by Vice President Ralston. All those in favor of approving the Sunshine Resolution, please say aye.
Aye.
Any opposed? Okay, so that passes unanimously. And then our second resolution really covers the Board of Health 2026 regular meeting schedule. It has our meeting schedule on it. Any questions about that one? Yes. Courtney.
I do have a question about the December meeting. Obviously, the fourth Wednesday runs into the holiday. Why have we chosen the second Wednesday, and are we sure that's the best?
I'm an easygoing guy, so I go with the flow on that one. I'll let Deanne explain why we chose the second Wednesday.
Yep. So traditionally, with both the November and December meetings being disrupted by holidays, this has been kind of where we split the difference between those two dates. It also aligns many times closely with the Board of County Commissioners' cadence for their approval of the county budget. So information regarding any changes or new information can be rather timely, coinciding with that meeting cadence for the Board of County Commissioners as well. But traditionally, with the two impacts of holidays in November and December, we've essentially split that difference.
And
Okay.
could I ask, Deanne, we could amend the schedule later in the year if we decide in the summertime, you know what, let's move it to the first week in December, whatever. Is that correct?
Yes, and also I'll note that we don't typically schedule a July meeting. In the summer, of course, we did that. This year, we did have a July meeting, and welcome to add additional meetings as long as we provide notice of those meetings.
I appreciate that. I don't have like any, it's fine for me either
a
way.
good
I just
question.
know some of the other electeds have standing meetings that are always at this time in the conflict, and so that was, it was out of consideration of,
Yeah.
but we can address it closer to time. I'm not opposed to that. I was just curious. Thank you.
Yeah.
Yeah, I'm missing PPACG right now, so.
Yeah, I think with 4 elected officials on this board, that's a
luck.
huge potential. Right now, neither Commissioner Nelson nor I serve on PPACG, so it didn't affect us, but obviously it affected 2 of the 4, and that could change in the future. So that was something that, and I know it's really difficult to find days where, but when we know it's on one of those standings, so maybe we could start looking at, you know, maybe it is a different day rather than Wednesday, or, you know, something else. I know it's difficult because you guys got, you know, you got Tuesday, you got Thursday, but if we could start looking now for a day that might work better prior to that December meeting, I think it would alleviate those, you know, having to choose which meeting you have to attend, right? So.
Yeah, and I think that makes perfect sense, and maybe Amanda can poll board members, once we're sure who's going to be on the board in December, and then we really kind of fine tune the date in December.
Yeah, and
Makes
as of
sense.
now, I'll just share for transparency here that I don't think we're going to see any changes at the county in terms of boards because we shuffled things up when Lauren came on board in the summer. We'll be just kind of staying the course. So as of now, PPACG shouldn't be an issue for either one of us. But yeah.
But for Todd, it would be, yeah. Okay, I think if there are no other questions on this one, then I'd look for a motion and a second for that.
So moved.
Okay, so a motion by Board Member Courtney Salt
Second.
and a second by Commissioner Nelson. And I just do this because sometimes when you're listening to the recording, you can't tell who's making the motions, and sometimes that's important. Isn't that right, Madam Attorney? Okay, that's why we do it. So we have a motion and a second. All those in favor, please say aye.
Aye.
Any opposed? So that also passes unanimously. Very good. And so now we'll go to Finance and Budget, item number 7. And I will turn this over to Deanne, and Deanne will tee up Lauren Mearmont, our budget manager.
Thank you. And today we have Lauren with us to cover several items, including financial summaries from October and November, and then we will move into our conversation about the original adopted budget. Thank you, Lauren.
So I have October financial summary and November financial summary, and so I'd like to focus more on November since some significant changes happened, but happy to walk through both months. So in October, we did project that we would significantly close our use of fund balance plans, which we've talked about in previous meetings. So we're actually looking at a positive impact to fund balance with the projections as of the end of October. And that includes reductions to some of our revenue streams, but also significant reductions to our expenses. And then between October and November, we received confirmation regarding one of our grants for our LPHA funding from the state for our discretionary funds. We had previously received communication that be about a $250,000 reduction in that contract, but we didn't know the timing of that. So then in November, we received the timing of those reductions, so that significantly changed my projection for that revenue source for state LPHA funding. And then just continued to monitor and update our activities for our grants and fees. No significant changes to report there. And then also in November, we got confirmation of our one-time pay for performance awards for staff. So that number was finalized, and so that impacted our expenditures for November. But again, still plan to end the year with a positive impact to fund balance. We will not have final information for the year to present to the board until March, is my understanding, just because of the timing to close the year and things like that. So I just wanted to note that November is pretty preliminary because the meeting is early in the month. We haven't actually closed the books for November, and then I won't have updated information through 2025 to share with you for quite some time. So this is a projection, but we're on the right track and happy to answer any questions about any specific items.
Any questions for Lauren? Oh, so I got the point. Dr. Chan.
In terms of the variance for the LPHA funding and the timing, are you anticipating that that variance is the $250,000 variance, or, you know, what is going to be probably down to $160,000 or something? Are you projecting that that's going to impact next year?
So it partially impacts 2025 and partially impacts 2026.
Okay, did we already have that in the budget for the impact for 2026?
It's built into the budget for 2026.
Okay, thank you.
Yeah.
Okay, very good. Other questions on this? All right, well, Lauren, this got to be your easiest visit to us yet, I think.
Well,
So
now we're going
very
to talk
good.
about 2026.
So far.
This presentation is regarding our 2026 proposed original adopted budget. On this slide, I have some changes from our last conversation for the preliminary balanced budget. We continue to receive updated information regarding our program-specific grants. So we received notice of additional funding for our Title X and STI grants of approximately $94,000. We received a notice of award for our CDC A2 grant with an increase of the planned amount that we were expecting. And then we received incremental funding for our public health emergency preparedness grant of approximately $150,000. And so I just want to note that those aren't like increases to previously funded amounts. Those are kind of bringing us back to level setting with reductions that we had previously accounted for. And then we updated our projected interest income. Very rough estimate of interest income, but increased that of approximately $50,000. And then we had an adjustment to our drug-free communities grant downward of $37,000. So all of those changes led us to an increase in our projected revenue for 2026 of $609,075, which is great. And then in relation to that, we did do some updates to our expenditure assumptions and estimates, mainly related to personnel, and that resulted in an increase of $598,000. And that brings us to our balanced budget, which still includes a planned use of fund balance for items we've previously discussed. So $284,600 use of fund balance planned for '26, including $15,600 for ADA remediation and compliance, $40,000 for update to our audio-visual system, $215,000 for 5 vehicles for environmental health, OWTS staff. And then we added an additional item since our last conversation of $14,000 for contracted professional services. So this actually is a less use of fund balance than previously discussed, but $284,600 is that amount. And then this is just a presentation of the percentage of our fund balance reserve in relation to our revenues, because this has been requested. So 2025 as budgeted, we would end the year at 22.8% fund balance. And then with my projections, it would be significantly higher at 26.8. And then carrying that forward to 2026, if things continue as planned, it would be approximately 27%. And again, our fund balance policy is between 18 and 21 is what we want to keep. So just noting those for reference. And so this is our proposed original adopted budget summary with our revenues and expenditures, and happy to talk through any of these numbers. And then just some breakdowns of what comprises the revenues and expenditures. For revenue, approximately 50% comes from program-specific grants, which we've discussed previously. A significant portion comes from the county, approximately 27% of our support. And then licenses, fees, and revenues is about 18, and our state LPHA funding is at 6%. And then our expenditures is primarily personnel at 77%. So happy to back up and go through anything in more detail, answer any questions.
Okay, yes, Dr. Chan. Dr. Vu. You doctors confuse me.
Thank you, Lauren. So as we expect to have an increase in fund balance, I stand by my previous arguments. We should use our very healthy fund balance to protect our staff and our workforce.
Thank you.
Okay, thank you, Dr. Vu. Any questions? Yes, Hunter.
Quick question on page, I think it's 17.
I'm sorry, I don't have
Yep,
the
go
page.
forward. It's the pie chart,
This one?
personnel versus operating. One more.
Oh,
Just curious, you've presented benchmarks on various metrics before in terms of El Paso County and other similarly large public health departments. Is this what you would typically find?
I'll have to defer to Deanne.
I think I'd have to look into that a little more to answer that with specificity, but generally, public health, this would be typical in that personnel as a service-based industry is going to be the majority of our budget, with a smaller portion for operating. Would be happy to look into some of the specificity around other LPHAs, but I would say traditionally this is very much in alignment with service industry
Great.
and personnel.
Just curious, and if don't spend too much time on it, but I just would be curious to
Yeah.
see what it is. Yep.
Thank you.
Okay, anyone else? Yes, Commissioner Geithner.
Yeah, I just want to speak briefly about the fund balance. I really appreciate where we are and the fact that there are additional one-time monies, but I want to make it clear it's really important that we do not use that fund balance as an ongoing FTE. One of the things that hopefully you've read about in the paper, as we've talked about this a lot at the county. The county has made a very concerted effort to not add FTEs and to keep the ongoing operating expenses at a level that is very manageable, because one-time funds coming from that fund reserve are so different, and that can make the difference between making hard decisions later and truly living within our annual operating budget as we move forward. So I actually want to compliment you for really doing the hard work on that, Deanne. I think that is really critical. It is why right now the county is not doing a lot of layoffs, and we're not a lot. We're not doing any. We're not doing any furloughing is because we've been very consistent over the last few years to not pull ongoing costs out of our reserve. And that has allowed us to make sure that we are steady on those FTEs. They're obviously the biggest cost. So when we're not careful about staying within that annual operating and not confusing that between your fund reserve and those one-time monies, it really can create issues down the road. We're seeing that with lots of other municipalities and lots of other jurisdictions, even around the state, even other counties. We just finished a conference at CCI and talking to folks about where they are. And so I really think this is a very fiscal responsible. I understand that, you know, we want to do, we do want to support staff, and I think that it's evident by the raises and the things that you see happening across the county. But we are able to, by keeping FTEs at an appropriate level, we're able to continue to take care and give raises to those that are here versus being in a situation where we try to have too many FTEs and then we're furloughing, laying off, and those things. So I think it's a very wise decision moving forward. It really follows closely what the county has done and I think has been successful with. So I really understand your concern for staff, and I'm glad that we were able to give raises and make sure that we continue to take good care of that staff. Thank you.
Board Member Salt.
So first, I just want to say, last month, Deanne presented the budget to the commissioners. This is something that we're supposed to be doing, I guess hadn't been, so she kind of like jumped in unknowing what to do, and I did attend that meeting, and I would encourage you guys to go back and watch it. It was right before Veterans Day. That I don't remember the date, but it's on their website. I encourage you to watch. She did a really good job. She talked some about the FT. Some of the stuff we've talked about in various meetings kind of all came together in one presentation. And so thank you for doing that. Thank you for doing a great job. And I would encourage you all to go watch it. It was very informative to me and helpful just to see it all together. Also, you mentioned when you went over the monthly things, you did discuss a little bit like the raises and one-time monies to staff. Now that's determined by what the county does.
Yes.
Could you just explain to us, since like obviously we want to make sure staff is taken care of, that's not our vote, we follow what they do. Could you just explain just high level, like what exactly did that look like, so we have a good understanding of that?
So there was definitely a methodology that we followed. I'm not sure I can remember all the specifics of it, but.
And I don't have the methodology at my fingertips right now, but I'd be happy to connect with our comp team and provide the board in follow-up some additional information. But generally, the county has moved to a framework where we have the opportunity to provide one-time performance incentives. So that occurred this year. We followed the county methodology, which really grounds those performance incentives in the evaluation scores and performance metrics. So it's a wonderful opportunity to tie directly that incentive to the work that our entire team does in performance evaluations for our staff. And then looking at annual increases into 2026, we are, again, following the county methodology and hope to have more information about that shortly for what that will look like moving into 2026. Generally, in mid-January, all staff receive a very comprehensive memo from compensation team that outlines annual changes for them. And I know that is something as well that has changed over the years, where people are really getting a good look at their compensation, the value of their benefits, and really good communication about what that looks like for them. So a lot of really good metrics that we're following based on county guidance and opportunities for staff to understand that impact directly at the individual level.
Awesome. I really appreciate that. Just since we're removed, it would be helpful for us to just have a general idea, because it is important that we know that they're being taken care of. And I mean, I trust lots of employees there, they're happy. So, but it would be helpful for us to have a better understanding of kind of an overview of what that looks like. So I appreciate it.
Yeah, I'm happy to follow up with that. Thank you.
Okay, thank you. And Dr. Chan?
Although contradictory, I would like to say that I actually support both Commissioner Geithner and Dr. Vu's point of view. When we talk about taking care of our staff, I don't necessarily see it as more pay for a job that they hate. I think that there are ways to use the fund balance to make jobs more efficient, easier, and more productive. And I would certainly support use of fund balance in that way. Thank you.
Thank you, Dr. Chan, and I believe I'm being guided to Commissioner Nelson.
I was going to just speak a little bit to how the county was navigating compensation this year and certainly come back with more detail, but it's an average 3% increase, and then it is based on performance and the metrics that was established with their manager of, did you reach your goals? You know, are you exceeding expectations, meeting expectations? And so if I remember correctly, a 3% would be that you're exceeding expectations, 2% increases, meeting expectations, and then, you know, less than expectations. And so, and this also happens across the other county departments and the other elected officials, where the county says, here's the dollar amount, it's, you know, an average 3% for all employees, but then it's up to those elected officials, so for example, the sheriff's office or the clerk and recorder's office, to then decide how they want to actually distribute that pay increase across their staff. And so, yeah, it is kind of an interesting model that I know that there's been a lot of thought and time and energy put in at the county level to make sure that staff are being taken care of, and that we are monitoring like the window that a position, their pay would fall under, like what's the word I'm looking for? Like the range that a salary might fall in per the position, and just taking all of that into consideration and allocating monies if needed to increase to meet market demand across, you know, that position across similar bodies. So just thought I'd chime in a little bit there, but can you repeat the policy of what fund balance? You said 17 to what percent?
18 to 21.
Oh, 18. Good thing I asked. 18 to 21%. So yeah, I'm just going to do some number crunching really quick, just to give myself an idea of how much we are over at this point. And not that we just want to like go out and spend it willy-nilly, but it is good for us to kind of keep in mind that we have this extra little one-time monies that as we hear about things, and you know, whether it's opioid epidemic prevention or just what are the needs our community has, that we can keep in the back of our mind. We have a little bit of extra one-time money that we could put towards supporting the needs of the community in an opportunity to serve in a unique way, potentially. But so, thank you.
Okay, thank you, Commissioner Nelson and Vice President Ralston.
And I just wanted to say an example of how we're supporting the staff is the purchase of those vehicles. And I think that's a really good use of the monies. And that's, you know, we're sensitive to their needs and also to the county's needs. And I think that's a really good investment.
Okay. At this point, if there are no other comments, is there a comment? Yeah. Okay, so we have a second on what Dora said. And then I would ask for a motion and a second to adopt and appropriate the 2026 public health budget as explained today.
Courtney Salt, I move to approve the resolution for the budget.
Okay, so we have a motion by Board Member Salt And a second by, who will it be?
Second.
Okay.
By Commissioner
and
Nelson.
a second by Commissioner Nelson.
Thank you so much.
Okay, thank you. If there's no further discussion, then all those in favor, please say aye.
Aye.
Aye. And any opposed? Okay, and so that passes 8-0 with Todd Dixon excused. All right, so we'll move on to number 8, or item number 8, which is contracts. And I believe Carolyn Gary is going to talk to us about the CDC Public Health Infrastructure A2 workforce capabilities. Sounds very, very professional. And go ahead, Carolyn.
Hello and good morning. Carolyn Gary, Development for El Paso County Public Health. And yes, I'm going to talk about our CDC Public Health funding. So this is funding that we've received from the Center for Disease Control and Prevention, CDC. It's a very long title, and it often goes by the CDC Public Health Infrastructure Grant, or FIG funding. The purpose of this funding is really to address the need for public health to remain agile and to be able to respond to any emergent needs as well as existing needs within the community. The funding period for the CDC FIG funding is from December 2022 through November 2027. So what's unique about this funding is that it was really constructed to be flexible, and this is often not the case with federal funds received by different entities. And so it was to really ensure that the funding could be used for the local community as it was needed, especially at the organizational level. So this funding essentially is divided into 3 components: workforce, foundational capabilities, and data modernization. We receive funding for workforce, our CDC A1 funding. We also receive funding for foundational capabilities, which goes by A2. We do not receive funding for the data modernization. Not many LPHEs, local agencies, received this funding. It primarily went to the state to address the infrastructure required for the data efforts as it relates to community health. So we're eligible to apply directly for these funds because of our population size. And we are one of 2 local agencies who receive this funding directly. Denver Public Health is the other agency that received these funds. The rest of the funding went to the state and is dispersed to the other agencies across the state. So our A1 workforce funding, this was a one-time award of $7,432,258, and this was received as a one-time award that we draw down from year to year. And again, this funding ends at the end of November 2027. And the focus of the workforce funding is to look at the capacity of the public health workforce and really address retention, training and development, and support needs. The A2 foundational capabilities funding, this relates to public health foundational capabilities. There are different areas of focus. For our agency, we selected strategic partnerships as a key effort in this domain. So the funding parameters for our A2 funding, and again, our A2 funding is targeting foundational capabilities. And the grant period for our budget period 4 award is from December 1, 2025 through November 30th, 2026. So A2 funding differs from the A1 workforce funding in that it's above and beyond, the over $7 million that I just mentioned. And this is allocated year to year, and it is determined by the CDC. So our first year of funding, we received approximately $450,000, and then in the second year of the budget period 2 and 3, we received $700,344, and so we were anticipating going back to the first budget year in terms of that allocation, and we got the nice notification that we were going to remain steady with our budget period 3 allocation. And so that's why you just heard about the increase in our CDC funding. So for this budget period, the plan is to fund 5.7 positions in the Women, Infants, and Children program, WIC. And the targeted focus for that funding will be to really address efforts as it relates to community partnerships and engagement, with looking ahead at sustainability and viability of the WIC program, really looking at how we address the needs, the emergent needs within different population groups across the community. Our objectives to create new partnerships and opportunities for co-location. So where are the services most needed? How can we partner with other entities working within those domains so that they know about the WIC services and we can better serve the clients, and develop a plan to address program viability and sustainability. What we're looking at for our key results is an increase in the number of community partnerships, optimizing the effort of the workforce through data analysis, and ensuring that our partners really know about the work accomplished through the WIC program. As I mentioned before, the grant period is 1 year. It ends at the end of November, so theoretically it starts December 1. This really is that year-to-year funding. We could look at a 5th year of funding that would take us from December 2026 through November 2027, but that would be dependent upon allocation from the CDC and availability of funds at that point in time. Each year, we're given the opportunity to come up with a new work plan or sustain an effort that was developed in previous budget periods. And that is why we elected to continue the effort that we started in budget period 3 going into budget period 4 with an emphasis on the WIC program. And that is what I have for our CDC A2 funding. So are there any questions?
And this is the first of 2 different contracts we'll vote on, but any questions from board members on this first one? Okay.
Comment.
Yes, Hunter.
On the key results, completely understand that the goal is centered around new partnerships and opportunities. I would just encourage you to think through the impact of reaching those presumably net new community partnerships, meaning how many more people, women did you serve? How many babies were impacted? So just always keep in mind the end user, if you will, especially for this program, because I think based on previous conversations, we would be very interested to know that.
Thank you.
Yes, Commissioner Nelson.
I am trying to remember a conversation we had a few months ago where we were having to adjust our budget and FTE. Wasn't the WIC department one that we saw a reduction in force? And so is this now bringing us back to where we were?
No, this will not be adding staff. This is for additional. This allows us to pay some of the staff out of this funding, but it doesn't add staff to the program. So in the past, when we talked about aligning our FTE, this doesn't change reductions that have already occurred. Okay. But this also is very helpful as we look at the WIC model, the sustainability of the program, and giving us the opportunity to explore our mobile services, bringing our services to communities a little bit differently than we have historically, moving more out of brick and mortars and into community partnership. So that is kind of the unique area that this helps us with, but it does not add FTE. It just covers the FTE differently.
Okay, and can you remind me, the WIC program is one where primarily that budget is going towards education of community members and not so much, like formula is part of it, but it's a smaller portion. Is that correct?
Yes, so at its core, WIC is an educational program focused on nutrition. And what we receive to pay for WIC services is for the administration and education components, and then the food benefit is paid out of separate funding through the state.
Okay. Can you give some examples of where, like what a partnership might be?
Sure.
Are we talking schools, hospitals, or?
Yes, and we have a really wonderful example of a key partnership effort with Fort Carson.
Yeah, so we partner with Fort Carson currently. We are there twice a week. They have enough potential clients on base that warrants that. We actually are looking to expand upon that to go be there more. But we're looking at other co-locations, such as like with Peak Vista. We already partner with Peak Vista here in Colorado Springs, but looking to expand in other areas of the county. And yeah, just trying to identify locations, using data, knowing where clients are, what zip codes primarily potential clients are, and looking at ways we can bring services to them outside of our brick and mortar.
Okay. Thank you.
Yeah.
Thank you, Deja.
Okay. Any others? Yes, Commissioner Geithner?
I'm just curious if there are discussions that are happening right now, and I brought this up previously about, we have a lot of changes happening. I think the WIC program and the education is important, and yet we have seen this is a program that's been around a long time, and chronic disease is getting worse. So, the idea of, is this program and teaching people to eat healthy, is it working? I think there's a lot of questions about that at the CDC. I know there's a lot of talk about the food pyramid and the things that have, quite frankly, we've been giving people really bad advice. And so are we seeing anything from the CDC? Are we seeing anything from the federal government saying, yes, we're going to continue this program, but we need to make some changes to what we are actually teaching? And is that something that you're seeing coming down the pipeline? I know it takes a very long time to change those things, but I'm just curious what you are hearing in that space.
So, as far as I understand, the funding and everything is intact for WIC and the food benefits. I think the program is routinely trying to assess and change to meet the needs. It's a very, rigorous, like the food plan or the food benefits, as we have talked about, are, they have to meet certain nutritional standards. The education that the educators are providing is very tailored to each client and each family and based on the food that they're receiving. So helping them understand, okay, if this is what you're getting in your food package, this is how we can help you make healthy meals out of this, or how this can complement the rest of your food budget. But as far as I don't believe they're using food pyramid anymore, but don't quote me on that.
Cheerios and cereals being one of the things that we're giving away to kids is a really big red flag to me, because I don't think anyone in this day and age really thinks those things are very healthy for kids anymore. So I guess that's why I'm asking. I know there's a lot of talk about that from the policy level perspective. I'm not sure if it's trickling down yet, or if you're hearing through that.
And I would just share that I think right now we haven't seen that move to implementation of a revised food package or an indication of what a revised food package would look like. That may come, but we're not hearing about specific foods being disallowed or removed from the food package or a complete overhaul. That may come. We're not getting indications of that yet. Yes.
Very much at the federal level, but I know things take a very long time.
And we've talked about that a little bit. I think it's an interesting thing in the realm of local public health as it moves through different layers of governmental public health before we get to the implementation level. So it may be coming, but details around that we don't have yet.
Okay, thank you, Commissioner Geithner.
Question also.
And before Dr. Chan, I just want to say that as a boy, I agree. I was not a big fan of Cheerios. I was much more into the Lucky Charms and the Sugar Pops. I love those things. So With
And
whole
I just-
milk, with whole milk, okay?
I just want to be
So,
super
it was
clear
not
that
all
WIC
bad.
does not allow
Are you
sugar
kidding?
sweetened Cheerios. It is the plain Cheerios.
Well, okay, that's good. That's actually better. Okay, but there is another question, Dr. Chen.
Yeah, I'd like to advocate for Count Chocula. So, okay, the question I have is your sustainability plan simply to ask for more money from the CDC again?
The sustainability plan, no. The sustainability plan really is addressing how we look at this co-location effort as a way to optimize the current workforce, ensuring that we have the human resources where the highest need is and making that a match, and looking at viable partnerships, and so that there isn't like duplicative efforts in terms of funding. And so, no. We're really looking at sustainability in terms of programmatic efforts, and how do we optimize our workforce as it is now.
So to some degree, are you looking to eventually move some of these efforts from the department, FTEs, to people in partnerships?
No, not necessarily. What we're looking at is how do we look at the capacity of the current workforce, how do we address that with the needs in terms of the client base, and then how do we better leverage partnerships? Because part of the WIC funding also looks at a composite of different variables, and so how are we, really addressing those variables within that funding formula over time with this effort and being really strategic in that.
I think I'm a little bit ambivalent about the program in general. I mean, I do feel that at no time is a person more aware of nutrition and healthy eating than when they're pregnant or have brand new babies. So it's a window of opportunity that's very, very important to address. On the other hand, I think what Commissioner Nelson might have been remembering, and the way I remember it, is we had a discussion about going into the fund balance to pay for WIC efforts when there was the threat of not having WIC funding during the government shutdown. Am I correct?
Yes, that's correct. We did have a conversation about if there was an interruption to WIC funding, seeking opportunities to retain staff, using fund reserve to support staff during that period.
And I think that discussion was certainly warranted. But I do have a little bit of, angst about sustainability for funding FTEs, this program, because we don't necessarily know what's going to happen going down the line with federal dollars. And so I'm concerned about increasing the outreach. I'm not saying that there shouldn't be increased outreach. I am concerned about creating additional clients who might be dependent on WIC nutrition, WIC funding. I think that the education and training is always important. But with the sustainability portion of that, is there some way to address what the plan is going to be if, again, we're met with there's not going to be enough money for formula or nutritional supplement?
And I would say that I think some of that speaks to the efforts we've been making throughout this year to really look at sustainable staffing within our budget and revenue. And I understand that there's uncertainties. We've certainly had them this year, and there may be uncertainties moving forward. And by looking at what is sustainable FTE, we have created opportunities for more flexibility within our budget. Also, I think one of the opportunities moving forward is as we look at chronic disease funding, that will be the next item we discuss. But there are indications that we will see more chronic disease funding moving forward. Nutrition is certainly an area that is important within chronic disease, and I think the opportunity to be able to have registered dietitians on staff with their level of knowledge and expertise and the potential to blend some of these efforts around chronic disease that incorporate some of the nutrition expertise could provide us with a pathway to more sustainability in the future. I think the CDC infrastructure funding gives us kind of that bridge and time as we anticipate learning more about chronic disease funding opportunities to build some of that opportunity to look at the expertise we have and how we might be able to better leverage that for the community. So when I think of the sustainability of this, that's part of what I have in mind, is the opportunity to look at chronic disease, to leverage some of the expertise we have, and to be able to move out of some of the siloed nature of our funding as it has existed. And as we've looked critically at our FTE, that's one of the things we've really been considering, is how do we move some efforts out of such strict silos and use our resources a bit more flexibly. Thank you. Yep.
Okay, and I'm gonna have comments from Commissioner Nelson, but I think we can bring WIC, as a discussion back or a presentation on WIC in the future. Really, our decision today is to whether or not to renew this previously approved contract for CDC Public Health Infrastructure A2 workforce capabilities. I think it's to the tune of $700,000. That's really what we have to decide today, but we can always bring this back. Been a lot of good questions and comments. Commissioner Nelson.
Yeah, I wanted to just back up a second and ask, with this grant, as I was reading it, and when I think about chronic disease, I'm thinking about, type 2 diabetes and heart disease, and can very much be nutrition led as the impacts of, or the outcomes that we see with diabetes or heart disease. So I guess, does this grant specifically say we need to put the money in WIC, or is that just your team has decided that's where we wanted to use this funding? I'll let you answer that.
Okay, so for A2, it was an intentional decision to prioritize WIC because of concerns for needing to examine the sustainability and service delivery model of that program, and to look at that, and this provided an opportunity to do that. So there was an intentional choice involved in A2 to prioritize WIC.
Okay. I'm not saying we shouldn't, I just wondered how much flexibility we have in deciding, or the department has in deciding, where we would like to utilize this funding, and how much was specified by the grant itself. And I think education is really important, but I'm thinking all ages. WIC targets a very small population. And so if it's that we can also get into schools and help kids understand nutrition, because I'm not sure that is such a big part of what they're learning day to day in their gym classes, or, in elementary on up. And then again, even 40s, 50s, 60s, on up, from the age range of where chronic disease actually is kind of where you see those outcomes more so. And I just wanted to echo Director Barnett's point about data and tracking that, how these services are being used by the community, and is that where the need truly is. And so we're just keeping track of how much people are utilizing this program specifically. We'd love to see that data as we continue forward. Thanks.
Okay, very good. Commissioner Geithner.
I would say I'm in support of this, but I may be making some assumptions here, but I want to make sure that I have these correct, and maybe this is valuable for others. This A2 grant was intended to be one-time funding, as far as I'm aware, correct?
It is designed as annual funding, and we find out each year if it is renewed. So it's in the same cycle as our A1, but it's an additional opportunity that comes each year. We don't know year to year if it will be allowed again.
Okay, so the way that this was explained to me from our finance folks, is that they did not expect that this would go on forever, and that this was kind of because when did A2 start?
2022.
Yeah,
really
so
2023.
again, this was a thing that started and they expected it to end at some point. So that's my expectation, is that this was never supposed to go on forever. It was supposed to be a shorter term to get infrastructure up at local public health. Again, this is from a policy up here perspective. This is my understanding. And so to the point about sustainability, I agree. Like, this is one of those things that I have, like, we should not depend on that. And I think Deanne did a pretty good job of explaining, and that's why things have been shifting around, because once this ends, and I think it is going to end in the not too distant future, then if we had stayed where we were previously and we're burning through the A2 money, and then we got to the end and we hadn't made any changes that have been made at this point, we would be in big trouble. And I think that's really kind of the whole thing, is that Deanne has been moving towards getting that in line so that when this does end, we will not be in that position. That's the way I see it. Deanne, you can certainly correct me if I'm wrong. And so I do think we should continue to receive this money. I think we should, vote in favor of this and have that money come in. And I think that the work is already underway to work towards that transition, as she said. And I'm going to echo, again, we could have a lot of discussion about what nutrition actually is, and the things that have changed. And so I do think that we should be mindful of, are we giving the right information? And I say that because, again, education is great, not if you're giving the wrong information. And I think that's what has happened, quite frankly, in our entire country. We all, like said, the food pyramid wasn't really science-based, all of those things. And so I just think it's good. It's good to focus on that WIC stuff. Obviously, it's going to be determined about what kind of information comes down, what kind of food is given to families. We don't have control over all of that, but it is a worthwhile thing to say. And my understanding also, Dan, you can correct me if I'm wrong here too, is that we have, the federal government gives us specific WIC funding for administration,
Yes, through the state.
but we are exceeding that.
Yes, that is correct.
And so that's where this comes in. And so I say, if we are exceeding what the federal government is giving us for WIC administration because we think this program is so critical, again, I go back to, if you're not educating on the right things or we're not getting the right things, then we have to question what the value in that is. But I do think that that information is coming. So anyway, I'm in support of this.
Okay. Leanne, do you have anything you'd like to kind of wrap it up with before we go ahead and get a motion in a second?
No, thank you.
Okay. Then I would ask for a motion and a second for approval of this contract.
So moved.
Okay, so a motion by Vice President Ralston and a second by,
I'll second.
and a second by Commissioner Geithner. All those in favor of renewal of the CDC Public Health Infrastructure A2 Workforce Capabilities Grant contract, please say aye.
Aye.
Any opposed? And so that passes 8-0 with Mayor Dixon excused. All right, and then we go to the second of the contracts. This is a new contract, and chronic disease came up, and so this one is titled Chronic Disease Framework. Community Health Promotion Division Director Daisha Hudson and Clinical Services Division Director Summer South will present this to us.
All right, thank you
Hey,
so
ladies.
much. Appreciate
Yeah,
it.
good morning.
So all the talk about chronic disease, I was like, just
That's
wait.
you.
Just you wait. I have a feeling there will be questions. Anyway, Summer South Clinical Services Division Director. This is Daisha Hudson, as you guys have already spoke to her this morning. Community Health Promotion Division Director. Oh, I forget I get to do this. All right, so this is the Local Public Health Agency Chronic Disease Pilot Grant. And both of us are going to talk about it today, and I'm going to start us off here. So looking at the what. So this is a non-competitive state-funded pilot program supporting chronic disease prevention. Eligibility for this grant was made possible due to the Tobacco Education and Prevention Partnership Program being implemented here under Daisha's division. They receive Amendment 35 and Proposition EE funding, which is the tobacco funding. And this particular grant comes from the Proposition EE only, and that's due to Proposition EE's greater flexibility, so being able to address things outside of tobacco. However, we wouldn't be able to be doing this as a non-competitive grant if it weren't for the program and the success of the TEP program. So, and the overarching goal, building long-term chronic disease prevention infrastructure here in El Paso County. This is a new funding opportunity, as we've mentioned. It will be doled out in 2 phases. What we are talking about here today at this meeting is phase 1. Phase 1 is 6 months, so starting January of 2026 and then ending June 30th of 2026. And that is the capacity building and assessment phase. And that is for the amount of $100,000. Then I'm just going to mention phase 2 a couple of times, but please remember that this presentation really is set for phase 1. Phase 2 will start July 1 of 26, and then with an end date in sight of June 30th of 2029. So that will set it on that fiscal year cycle after the first 6-month implementation. All right, next slide. So that is the what, the why. So really, again, reiterating this idea, long-term chronic disease prevention here in El Paso County, that is what we want. And we want to do this through a sustainable model. We want sustainability of chronic disease prevention over time, irrespective of the funding ups and downs that we often see. So this is speaking to that sustainability piece. And then, generally speaking, we want to prevent preventable deaths due to chronic disease. This is based on a 1-3-4-50 framework, and I'm going to go ahead and explain that to you. It's quite a clever little name. But basically all it says is that every individual's lived experience contributes to 3 health-related behaviors, and those 3 health behaviors then contribute to 4 chronic diseases, and those 4 chronic diseases account for over 50% of all deaths. So breaking this down a little bit more, those 3 health-related behaviors are tobacco use, physical inactivity, and poor nutrition. We've talked a lot about this already today, which I think is great that we're having a more in-depth conversation now. And those 3 health-related behaviors contributing to the 4 major players of chronic disease: diabetes, cancer, asthma and pulmonary disease, and then cardiovascular disease. And so the little infographic there, you can see chronic diseases account for over 55% of all deaths annually in Colorado. So that's a pretty big number, and I think a pretty great target for us to be focusing on. All right, next slide here. Okay, so implementation. Again, this is a 2-phased approach. We're talking about phase 1, our capacity building and assessment, and then phase 2 being the implementation of selected strategies. And then phase 1, really what we're looking at as far as our focus are 3 main focuses: establishing internal and external stakeholders, assessing and building agency capacity, and then the education and promotion of our community members, our potential community partners. So Daisha is going to take us through the next 3 slides, which are going to touch on each 3 of these focus areas. And then at the very end, I'm going to give a high-level overview of what phase 2 might look like. Daisha.
Okay, so as Summer mentioned, we're really looking at 3 different focus areas for this phase 1. I may call them deliverables. It's just how I'm used to speaking, so I apologize. But this first main focus area of establishing an internal and external stakeholder work group really has 3 key steps, and that's convening an internal stakeholder group, which we've already done. We had to identify staff as part of our application process to be part of an internal work group, but we're very intentional in looking at staff who either have expertise or interest in building capacity around chronic disease prevention here in our agency. Step 2 is identifying community partners, and we hope to include the Board of Health in that, and we'll plan to come back in the new year and kind of figure out together what that looks like and how the board wants to be involved. But, at a certain point, we're going to want to include our external partners so that we can really start looking at identified strategies together. And then conducting partner outreach. We want to leverage our existing partnerships and resources, but as we identify evidence-based strategies, that may mean that we're looking at new partnerships or rekindling existing partnerships. So doing partner outreach as part of that stakeholder work group. The second focus area, and what I would call our main deliverable of phase one, is completing the chronic disease community assessment process. We have 6 months, so January through June. CDPHE, the State Health Department, has developed a tool for us to use that outlines this, so it's really helpful. But the first step of that assessment process is really looking at our agency readiness. And so going through, we also have a list of evidence-based strategies that were provided to us from the State Health Department that focus on those chronic diseases that Summer mentioned in that 1-3-4-50 framework. So we'll be reviewing these strategies and trying to determine, like assessing our community's needs, our opportunities. Is our agency ready? Do we have staff already that we could support these evidence-based strategies? And then from there, we will pick our top 5 strategies. So the top 5 that rose to the top, and then that'll take us to step 2. We're going to start gathering and reviewing state and local data about those top 5 strategies identified in step 1. Our data and analytics team has already began looking at chronic disease data, and we have our community health assessment. So we have a lot of great resources already and feel that we have what we would need to be able to collect relevant data around the evidence-based strategies. And then from there, this is where we would come together, internal and external partners, to further discuss and assess those top 5 strategies, take a look at the data that's been gathered, and really determine what we want to focus on as a community, what does our community need the most, and kind of go from there. Step 4 would be selecting and summarizing our top strategies. So from the top 5, we would be looking at selecting a top 2 to 3 strategies, at least initially. And really what we would be summarizing and providing back to the State Health Department is our key findings, potential next steps. And it's really important to us, and I know it is to you, that we identify metrics and how we measure success. And so that is something that we have intentionally added to this assessment piece. There's elements of it in there, but we really want to identify those metrics ahead of time. And then this third focus area is education and promotion of chronic disease prevention in El Paso County. Education and promotion of, health prevention is really at the core of what we do in public health. However, this pilot funding, this phase 1, is going to allow us to be more intentional and build a foundation of knowledge and awareness about chronic disease here in El Paso County. Really helping the community understand, and I feel like I talk about this every time I get up here, but in what we do in community health promotion, it's so important that you understand what it is we're talking about, so that you understand, the risks, how we can help, things like that. So understanding what chronic disease is, what chronic diseases are, what causes them, and then also wanting to make sure that we help the community understand how we can potentially help. So educating the community. Step 2, promoting chronic disease intervention and treatment options. We already do this to a certain extent, so we'll be looking at our existing resources in the community, but also as we're identifying those evidence-based strategies throughout this process, I think we're going to be reaching out to other partners in the community so that we can go ahead and start, making those connections for the community as we identify chronic disease risk factors when we're out educating. And then, as we learn about our existing resources, we'll begin to form those partnerships if they don't already exist, and that's really where the community collaboration is going to come in. So around those top 2 to 3 evidence-based strategies that we choose through the assessment, we're going to start wanting to bring community together, community partners together, and start collaborating on ways we can address that. So in summary, our main deliverable, as I said, is completing the chronic disease comprehensive community assessment and selecting our evidence-based strategies for implementation in phase 2. And then also strengthening our internal capacity. I know we have written in, different trainings for folks that we've identified on the internal team, increasing community engagement and awareness, and strengthening community capacity as a result of those other areas. So now I'm going to hand it back over to Summer, and she's just going to give a high-level overview of what phase 2 may look like, given that we're not there yet.
Appreciate it. All right, so looking ahead, phase 2, our goals are to develop an implementation plan. So from the assessment, there is a requirement for an implementation plan to be developed comprehensively based on the strategies that we have chosen, and then for that to be submitted. And then, of course, the implementation of said strategies. So that's what phase 2 will look like. Those are our 2 main goals. Intended outcomes. So overarching intended outcomes: reduce chronic disease risk factors in our community, improve chronic disease management, and then promotion of positive health outcomes. And what I wanted to speak to when it comes to the health outcomes, because we do talk a lot about, and we've already mentioned it several times today, looking at different metrics. Are we measuring the right metrics to really determine, is the juice worth the squeeze? Have we made an impact? Is this going to be sustainable in the long run, et cetera, et cetera? And so I just wanted to give a proposed example of what this might look like. So, and again, I'm not speaking to all of the strategies in phase 2, but one of the main areas, the focus areas, is diabetes prevention. And a possible activity would be a diabetes prevention program. And we have the diabetes prevention program, in the United States. It's an evidence-based program. There's lots of data to support it, but I'm not going to go into those details. However, some of the metrics that they measure in there are things like people who participate in this. Are they getting 150 minutes of activity or more a week, which is said to help reduce diabetes, so prevention from converting from prediabetes to type 2 diabetes. A certain amount of weight loss for participants who begin and end the program. How many educational events did they attend? What kind of education are they receiving? Are they gaining knowledge? And then overall impact within the community. What, and this is a little bit more long-term when it comes to data is, okay, so we implemented this program here in a year. What does this look like overarchingly for El Paso County? Have we reduced the instances of type 2 diabetes? And we can use that, some comparative data when it comes to that. But those are just some examples of one activity within one strategy in which we will be looking at different metrics to measure, have we promoted positive health outcomes? And I wanted to mention as well that because we are convening an internal stakeholder group and having Board of Health representation and community partners, we get to define for us and our community what those metrics are, how they should be measured altogether, so that we have not just buy-in from us, because of course we have buy-in here, but other individuals have buy-in so that we can move this forward in a sustainable manner. All right. Any questions? I didn't think so. All right, I'm out.
Board Member Barnett.
Thank you, and thank you for that. That was a great presentation. So a quick comment, 2 quick questions and a request. It'll go by fast, I promise. Just to underscore how important this is, I mean, for me, I'm really excited. I think most of us, if not all of us, are going to be very excited by this program. We spend nearly $6 trillion on healthcare in this country. That's 20% of GDP. You can fact check me on my sources, but if I recall correctly, about 80% of that $6 trillion is on chronic disease. And 80% of that 80% is on preventable chronic disease.
Yeah.
So preventing, reducing avoidable deaths, absolutely the right metric, but just the size the problem and the opportunity we have ahead of us doesn't get much bigger than that. So as we think about impact and the great work that we can be doing, in addition to what we're already doing, it doesn't get much better than this. So 2 quick questions. One, on the 100,000, what exactly is that going towards? Because it seems like this is a lot of research, a lot of meetings. Is it in the third bucket of marketing and like travel? What exactly is the 100,000 going towards?
Yeah, so the vast majority of that funding is going towards personnel. So we have convened internal stakeholder work group. That is not adding FTE. That is our own individual staff who either have subject matter expertise or, bringing them up to speed to support the work and focus on the community health assessment. And then there are a couple other components that it'll be going towards. Did you want to speak to that at all?
The training, so there's very limited operational costs, there's some training costs included, and then for outreach, because education and promotion is one of the deliverables for the grant.
Gotcha.
Yeah. So, and the training might look like getting individuals up to speed. So let's say we choose diabetes prevention in some form or capacity. We want people to have those additional training programs, and so that costs money. And so this provides us an opportunity to shore up our SME so that we're geared up and ready to go and hit the ground running once phase 2 begins.
Gotcha. Second quick question. On community partner outreach, are you thinking about including companies that are doing this well, ideally locally? Is there anyone on your list?
Can you explain a little more what you mean? Like companies that are doing?
Yes, in healthcare, who also have expertise in this. I think it would be a huge miss to not include at least one.
Yeah,
or
I
several,
think
or more.
that's still to be determined, because we'll need to review the strategies and see as an agency what we have capacity and readiness for. And then once we have determined that, then we can start, and you guys could definitely be part of that conversation and helping us identify other key partners in the community.
Yeah, so that's the beauty of this particular phase, is that we get to choose those partners. We haven't pre-selected anybody yet.
Great.
This is all beginning.
And to wrap up, that was my request, is thank you for putting on there, hopefully open to everyone who wants to be involved. So I personally would like to be involved. And I know others will probably want to as well. So thank you.
Yeah.
Awesome, yeah.
And like USAA used to have a good program, and what they'll do is they'll measure certain components. I used to do the test when I was a PA of their blood pressure, their hemoglobin A1C, et cetera, and then their insurance rates through, they get financially rewarded if their metrics are favorable. And the interesting part of this will be is we can't go off on a tangent, but the 2 doctors in the room, I think, would agree that when you treat patients, you give them all the advice of diet and exercise, and then in a plan and handouts and a referral to a nutritionist. But that's the hardest thing to change, is just personal behavior. Will the person do the stuff? So education is absolutely necessary, and then we'll see how our results are. Commissioner Geithner.
Yeah, I too don't want to spend a ton of time on this, but I'd like to recommend that maybe we have a subcommittee that looks at and stays in closer contact for those who are really excited about this topic. And I think that there are some, we've talked about it a lot. And I also want to say, you hit on, there are 2 things that I think. One is someone has to be willing to implement whatever it is. But again, I'm going to go back to, they have to be given the correct information. One of my favorite YouTube videos of all time, and if you haven't seen this, I'm going to personally send it to you, is the guy who travels back and forth from the future to the breakfast table of the family, and is like, no, stop, don't eat that, that's not right. And then he comes back 10 years later, is like, wait, we were wrong. And this is a reality that I think we have to acknowledge, and this has to do with trust in public health and government as well, is we have to really know what it is that we're telling people. I've personally been given bad advice by doctors. Sorry, but it's true. You're not all created equal. And also science changes. We learn more, all of those things. And so I think when I talk about things trickling down, this is exactly and I go back to the food pyramid just because like the worst example probably of anything that's ever happened, and it really wasn't science-based. There is evidence that shows what happened to the American, what happened to Americans related to chronic disease when the food pyramid came out. We got a lot less healthy because it's bad advice. So we have to talk seriously about what the good advice is that we're giving. And also low-fat diets, which also really hurt because we started having all these extra sugars and all these things. So I don't want to get too far down that road. I just think there's a lot of excitement around this topic, what we've been doing and what is actually going to work for people. And so, yes, they have to change their behavior, but we have to tell them the right things. And so looking really closely at what is the emerging science and getting the experts involved and taking a look at that, I think really could make the difference in whether or not these programs are actually effective for our community. And then great that we are going to have outcomes that actually measure whether we're doing the right things, right? So really excited about it. I think we should have a subcommittee from this board so that we can stay involved in that for those who want to be involved, or if the whole board's like, gosh, we all want to be on board, then I guess we just do it with the whole board. But just an idea of a way that we could potentially use a subcommittee to help stay more engaged on the topic.
Yep, it's very complex because, the knowledge changes. What we believe is correct moves. Is it correct though that board members can be part of this process or committee?
Yes.
Should we form a separate subcommittee, or should we just have appointed or volunteers who are part of what's the meetings, et cetera?
I personally
guess
think
we'll
it'd be
sort it
great to
out.
work together,
Mhm.
but if
Mhm.
the board wants to have a separate subcommittee and like a liaison, or however you guys decide, but I.
So, do we?
And I think we can mesh out some of the nuances. Just the overarching point here is that we want you all involved.
Yeah.
We know that you guys have a strong commitment and an excitement and a passion for chronic disease prevention, as do we. So it just makes good sense to have everybody involved and a voice.
Okay, and then perhaps we'll find out how many want to be on it, and then if it's more than two, then maybe we go the subcommittee route with two on.
And I just want to add, we're super excited too, just the flexibility of this funding, allowing, even to be able to come up and present together and work on this together as two different divisions. Just the flexibility is really nice, and so we're excited too.
Do you have an opinion on Lucky Charms versus Count Chocula?
Are we talking taste, nutritional value?
What kids will eat?
Cost?
They'll eat both of those, I promise you. Okay, we do need to vote on
can
this, but yes.
Can I make a
Dr.
comment and also
Chan.
ask a question? I understand we're just voting on phase one.
Yes.
That part I understand. I think that in terms of, I don't want to whipsaw the expectations because I know I'm one of the board members who is constantly harping on chronic disease and constantly harping on presenting outcome rather than output data. But chronic disease is very different from acute public health concerns like opioid.
Sure.
And I think that it's fairly unrealistic in phase two, even at the end of phase two, which is 5 years from the start of phase one. I think it's fairly unrealistic for us to try to pressure you to present outcome data because the very definition of chronic disease is that it's chronic. And if you make an intervention now, you may not see outcome until 10 years or 20 years from now. And so in the design and implementation of this program, I think it's important to keep that in mind and then have benchmarks along the way,
Yes.
such as something like decreases in A1C. Obesity is something that can be decreased within that 5-year period. And that brings me back to my question about phase one in terms of the assessment of needs. Does the state already disaggregate their data about the 3 behaviors and the 4 disease processes to the county level?
So from this chronic disease framework, we don't have data from the state that said, hey, El Paso County is here, 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 and here. However, we are utilizing our internal data and analytics team, using the best data available currently, whether that's through community health assessment, Common Spirit, the brief survey, et cetera, to look at El Paso County compared to the state as a whole. And then we have that capability moving forward. We've already asked our data and analytics team to provide us with some of that data, which, you know, this being a phase 1 presentation is not a part of this presentation, but that is the intent. But did I answer your question, first of all? And then I wanted to go back to your comment on outcome data.
I think you did. I think you answered the question.
Okay.
So what you're saying is that you do have data about El Paso County, about those 3 behaviors and the 4 disease processes, and you are able to compare that to either other counties in Colorado or Colorado as a whole?
Colorado as a whole, yes.
Okay.
Yes,
All
we
right.
do. And then I just wanted to speak to the outcome data. You're absolutely right in that we cannot provide outcome data that proves or disproves in a short period of time whether chronic disease is reduced, eliminated, et cetera. So the magic here, and again, this is all going to be based upon multiple individuals' input and expertise on things like data and outcomes, in that we can take a strategy from one, or an activity from one of the strategies, and we can have data to measure the success of those programs. And those will be, you know, those benchmarks kind of in the moment, year to year. But then hopefully with the sustainability of this program, as we move forward, as we have, you know, external stakeholder buy-in, and we can continue this on regardless of funding, then we can start looking at data over a longer period of time, 5 years, 10 years, 15 years. What does it look like in El Paso County? How we reduced the number of deaths associated to chronic disease, et cetera. So your point is well taken, and we'll be a part of this process.
And I just wanted to add that I really appreciate the comment. Having worked in tobacco prevention for 10 years here at the agency, that is a slow-moving, data doesn't, you know, it's over time. So we're seeing like decreases in use and health outcomes over time, and so I do appreciate that. I think the beauty of this, and you touched on it too, is that we're starting this together, and we're going to be on the same page about what we're measuring and how we're going to determine success, and I think that's going to be really great.
I'd just like to say that our hospitals have community health needs assessments, and you can get that data there. And they've recently, fairly recently, earlier in the year, they have to do this every 3 years, and so it's pretty up to date. And a lot of them are consistent with, say, this Common Spirit system with UC Health. Their data is very similar, but they're required to do it, so they do it in Children's Hospital. And upstream primary prevention is really, to me, the key to long-term reducing premature death and disability due to these chronic diseases. And that does take time. It takes patience. So, and thank you for the thorough presentation.
Okay, very good. Thank you, Vice President Ralston. Yes, Commissioner Nelson.
I promise I'll be
Okay.
fast.
Okay.
So maybe I missed it. When will you have that community assessment? And I guess the second question is kind of what Ms. Ralston was saying about accessing that medical data, because I'm thinking specifically cancer is a very large bucket, and we
Yes.
know that there are some kinds of cancers that we're still figuring it out, like why is this happening? But there are others that we know very clearly tobacco causes cancer. Human papillomavirus is
Right.
also, you know,
Yes.
so there are certain ones that we could tackle that we know the why, and that HPV, like, hey, it's abstinence, it's vaccinations if you're a believer in that. Like, there are preventative things that we could go after in this that we, do you know what I'm saying? Like,
Yeah.
cancer's a really big bucket, so I'm kind of curious your
Yes.
thoughts on that. I've asked a couple of questions there. Timing on the community assessment, when you expect to have those results back, and then helping us to be able to know where we're going to focus and prioritize.
Yeah. So the the community health assessment that we will be doing as a part of this phase, that is what the end product is. So by the end of the 6 months, we should have a comprehensive community health assessment and identified strategies for these various areas. And I mean, you spoke to it well as far as cancer being a very large bucket. And so again, I don't want to get too into the weeds with phase 2, but that's what it's all about, is pulling those pieces apart, pulling those areas apart and looking at it and going, okay, our agency, where do we have capacity already built in? Where can we strengthen that capacity? Where do we say, no, we just don't have the ability? And what community partners can we involve to make it more robust, to have that additional buy-in, and to hopefully then make some movement, and then to choose the activities that go within those strategies to tackle said chronic disease.
And based on the data. We would start,
yes.
The second step is pulling all the data related to the top 5 strategies that we determine that we have readiness and there's need for. And then
And we've already
learn.
started a lot of that with our, looking at our chronic disease data, Common Spirit being one of the most recent published community health assessment data pieces that we're looking at.
Yeah. Okay, that's great. I love this presentation, especially this slide about the why. And just, I feel like you're defining it for us of what chronic disease is, and because something that comes to my mind, like asthma and pulmonary disease did not come to my mind, and so not being in the medical field, maybe for others it did, but it's just really helpful to have this information, so thank you, and I look forward to seeing what you guys what El Paso County looks like and where we need to focus and prioritize, and how we're going to get after some of this, and knowing that behavior is so hard to change. I mean, even my own kids, like my degree's in food science and nutrition, like I'm like, okay, you want some ice cream? Go eat some vegetables first, or a piece of fruit first. Like there's, balance, right? But helping them understand, it's so hard sometimes, even as adults, to be like, yeah, but it tastes really good, and I want to go eat that. And so the behavior piece is something that I see as being more challenging. But so I'm like, what's the low-hanging fruit that we could get after first of, educating people?
Sure.
Absolutely.
So, yeah, thank you so
another
much.
thing I just want to add real quickly is that, the tobacco funding, that's a 3-year funding cycle, and because it's funded by, tobacco tax dollars, like we see that continue, and we've been able to make significant progress because we've had steady funding, and given that this is going to be funded out of Prop EE, which is the nicotine tax, so the vaping and things like that, hopefully there'll be some continuity there to help us really build a strong foundation.
Yeah, awesome. Thank you. Exciting.
All right. Okay, looks like the questions have been answered.
I move approval.
Okay, and we have a motion. We have a motion from Commissioner Geithner, and do we have a second?
Second.
Second from Commissioner Nelson for the chronic disease framework. I think we've had our discussion. All those in favor, please say aye. Aye. Any opposed? I don't see any opposed. So with this one, we get a 9-0 vote. We'll include Mayor Dixon on that one. And thank you, Daisha.
Chair Donaldson, my vote should probably be abstain, since I came in the middle of the presentation.
All right,
I don't feel I've got the full.
8-0 and 1 abstained.
Yep, thank you.
We'll just say excused. So 8-0.
Yeah, there you go.
Yeah, thank you, Daisha, Summer. Thank you very much for that presentation. We look forward to it.
Yes, thank you.
Okay. So we'll move on to item number 9, which is new business, which is election of the 2026 board officers, president and vice president. First one is election of the president, so I think I'm going to force our vice president to actually work on this and kind of run this little part of it. And my thought would be that we have nominations first, then allow candidates speak for up to 3 minutes, and then vote. Any other proposals on that? No? Okay. So I'll hand it off to you, Doris.
Thank you very much, and I look forward to hearing all of your perspectives. So open it up for nomination for president.
Okay, we're going to open it up for nominations for president, and I look forward to hearing from all of you, your perspectives and comments. So anyone like to do that? Commissioner Geithner?
Thank you. I would like to nominate Hunter Barnett to be our next president. I've been really interested in hearing Hunter's perspective. I think he has a lot of great experience in the health field that we really haven't tapped into, especially as we talk about this chronic disease perspective. I know he's very passionate about helping our community, and just think that he would do a great job for us.
Okay, any other nominations?
I want to say that I really appreciate anybody who wants to step in for leadership. I think it's really important that we have people who are enthusiastic about the role. At this time, I would like to renominate or nominate Dave. And the reason I decided to do that is because we are going to be facing a time of transition. We're also coming out of a time in which public health took a bit of a hit. And I think that Dave is pretty well known to the residents of El Paso County. He's also had some personal attacks in the media, and he knows how to navigate those. He also, I think, knows a lot of the key individuals in the department and their interactive dynamics. And I think that as we move into getting new executive leadership, it's important to have some continuity. And I think that there are many members on the board who would be able to step into that role, probably in the near future, but for now, I would like to nominate Dave.
Thank you. Hunter, maybe you could ask or explain your background and your experience and why you're interested.
Sure. Is that it? Anyone else? No.
No, I don't think anybody else.
Okay. First of all, I just want to say thank you to Commissioner Geithner and by extension, Commissioner Nelson, just as the appointing authority to this board. I have thoroughly enjoyed my time over the last 12 months. As I think about not just this board, but the various ways to get involved as a citizen in El Paso County and in Colorado Springs, it's these types of opportunities. My family and I moved here 3.5 years ago, and after getting settled and just all the things that come with moving, one of my big goals was to join a citizen-led board and commission to do just this. So I'm just feeling very grateful just to be on this board. It's been very fulfilling, and I'm really excited by the step-up opportunity. And for the record, as Dave and I did chat about this, this is not a, I'm coming for you. This is simply, I've done this now for the past year and would simply appreciate the opportunity to step up as a leader. So 3 brief things for consideration for all of you. One, I think over the past year, during these meetings with speaking up, asking questions, the outside of meetings, we've shared emails, I think almost on day one, of just asking questions and what about this analysis? Can you provide that data? I think one, just showing the continued focus on outcomes. I know I'm not the only one, but I know that was something that I think I brought very early on, which is we can't just focus on activity, but what are we getting for it? Always keeping in mind our fellow citizen in terms of, are we actually helping them, helping the community with their health? And then 2, from a fiscal responsibility and somewhat fiduciary responsibility. Number 2, this one will be very quick. My focus on chronic disease. See the previous 30 minutes of discussion, I think, with what we had. I think that is the most important problem that we're facing, and would look forward to continuing being a leading voice for pushing not only this board, this department, but eventually our new hire, to continue to focus on that and to innovate within that. And then 3rd, as Commissioner Geithner said, I love this stuff. I'm very lucky I get to do it for a living outside of this volunteer opportunity, and would just ask you all to consider that I think I bring a unique perspective to public health. I'm still, I think, learning what it means to bring over from the medical health side into public health, but I think there's a lot of stuff to continue to think through and apply. So for those reasons, I would appreciate your vote. And no matter how it turns out, I'm still going to be here and still enjoy contributing.
Yeah, for sure.
So thank you.
Questions for Hunter, because I do have one. So what is exactly your title? And are you more in innovation and finance, not direct healthcare services? I just want to make, we have some clarity here on your career.
Correct. So I'm on a new product development and innovation team. Now within Optum, we get moved around a lot. So Optum is part of United Health.
Okay.
And what I get to do every day is at least try to make healthcare better for everyone, for our patients, our members, the system, all of our stakeholders. So correct, I'm not a clinician.
Okay. I just wanted to clarify that. Thank you. Any other questions? Okay, Commissioner
Really quick,
Nelson.
what seat are you fulfilling on this board? I know we have medical seats, we have finance seats. Which one are you? At large, whatever. Or citizen?
Right. The community nonprofit,
Okay.
given other activities I'm a part of as well.
Okay, thank you.
Okay. Dave, could you also share?
Sure. First, I want to say thank you to Hunter, because he did the honorable thing and he called me up and said, hey, I'm interested in serving as president. And he didn't have to do that. Sometimes that's unusual for someone to be as straightforward about it as that. So thank you to Hunter. I appreciate that. Thank you to all of you. You elected me, I think it's 9 months ago. Those of you that were here, to let me serve for those 9 months. It's normally 12 months. Normally you get elected like we're doing it this time. I would like to serve an additional 12 months, like fill out that first one and do a few more. After Dr. Chan's nomination, I almost don't want to say anything else because she did such a good job. I could just stop right there. But there's several things I think I bring to the table. One is just having been here for the last a little over 4 years, 4.5. So I have just sort of a knowledge of how we've gotten to where we are. And during that period, I've established a relationship with the leadership team, with members of the staff here in public health, and I think that's beneficial. It is a period of transition as we're, in an interim director time right now, and we'll finally get to a director. In fact, the whole time I've been the president, we've been in that position. So another thing I bring to the table is just the medical background, and I do think that's useful in your chair for understanding certain things. Like when we discussed the program at the jail for testing for STDs. I've done those exams, I've done those tests. I can understand why the contracted entity at the jail might not really be interested in doing that. They would like to get past that and just stick with their, minimum essential medical examinations they need to do. So I think that's helpful, and I think it's helpful when we have discussions to have a background in medical knowledge. Immunizations. I mean, I've given thousands of shots back, in my career. Hepatitis B, hepatitis A, all kinds of various immunizations. When I say that I feel like I have a good relationship with staff here, that's also not to say that I agree with everything. And when I first came on was during the COVID period, and the staff will tell you I was, when I think something is wrong, I don't hesitate to point that out and demand changes. And we changed basically the email policy. We changed where we held the meetings. We went downstairs so citizens could come in. They didn't have to be escorted up here by a sheriff or deputy sheriff. And so that, I think that's important to point out. My knowledge or just experience with other electeds, I think, is helpful. When we met with the folks from Fountain, Mayor Thompson, Representative Mary Bradfield, they know me, and as Dr. Chen kind of pointed out, I have a reputation for being honest and looking out for citizens, and I think that serves the Board of Health well when citizens, when I explain something to them, generally they trust me, I'll put it that way. I'll just glance down here for a moment. And I think that pretty much sums it up. So I will, I ask for your support for going through year 2026. And again, I thank Hunter for being honorable in the way we kind of went about this. So thank you.
Okay, questions for Dave. Commissioner Nelson.
Actually, it's a question for both. So I was asking about which seat you fulfill. How long is your term? Do you know how much longer you have left? And then same question to Dave.
Yeah.
I think I have 7 years left. It's 8 years? Oh, 4. Oh, okay.
Well, 2 potential 5 years.
So I'm 1 year in.
Okay, so you have quite a bit of time left on this board. And then,
Well, I mean, as you know, county commissioners kind of determine that. It's a five-year term. That has changed. I mean, I have a appointment orders, or whatever the proper term is, for 3 years signed just within this year. But recently, I've received one signed by both Commissioner Geithner and Commissioner Nelson, stating that it's actually 5 years from when I was first appointed, which would be July of this year.
yeah.
Okay? And I would say that's even a better reason to reappoint me, because that'll get us through the, then it'll be, do I get reappointed by council? Does council kind of nominate me back to the county commissioners, and do you approve it? Well, okay. I would ask my colleagues up here, don't hold it against me that I rely on the county commissioners to reappoint me if they choose to.
Yeah, I just want to clarify that. So, yes, the term ends in July, and that was per statute. There were some changes in interpretation, or I will just say adjustments to our resolution. When our county attorney changed, we had some looked closely at the statute, and this was quite a while back, and our resolution was changed. Actually, I think it was before you even came on board, Dave, but there was some just internal confusion about that. I know it was listed incorrectly on the website, though you and I had a conversation about it about 6 months ago. So I do, in terms of continuity, want to point out that there is a chance that Dave will not be here for the next year. So if we're talking about continuity, that is a concern for me. City Council does not get to make that decision. There's, again, been some confusion over the years. That is actually a decision that will solely be with the county commissioners for any city council member to be appointed regardless of what the city, there is no city decision point on that. I do know that there are others who are interested in serving as well, and I think that that is something to consider, that likely there will be that consideration in the next year, and that decision will have to be made.
Yeah,
Dr.
Very, very good. Then I would just ask my colleagues to let me finish out as the president then, in case it is a short period of time.
I just want to respond that it is not up to Commissioner Geithner and I on the terms. It's in statute. So just to bring clarity to that comment that was made. And so we're very grateful for the time that you have served. So just want to make sure everyone understands that everyone here is appointed for a length of time by statute. And we're grateful for all of you for how you serve.
Dr. Vu.
Can I have a follow-up on Commissioner Nelson's question for Hunter? Hunter, which seat are you filling on the board again, please?
The community and nonprofit representation.
Okay. Then is Optum Health or United Health nonprofit?
They are not. I have other activities that I'm a part of that I included in my application that was reviewed by all the county commissioners.
Thank you. And which nonprofit organization is that?
One of them is the leadership program in the Rockies.
Okay, thank you.
Okay, I would like some clarification, Commissioner Nelson. So could county commissioners, if Dave's still on city council, could you guys reappoint him?
We could. That will be a conversation that the commissioners have of who is it that we would like to appoint to this board, and it's a vote of the whole commissioner board. But as the representatives on this board, it will be Commissioner Geithner and I that bring a recommendation of who we would bring to the other three commissioners.
Thank you for that clarification. I would just like
And
to...
that's, I'm sorry to interrupt
That's okay,
you.
no.
We oversee many boards and
Right,
committees.
right.
And so it's just, it's part of our process, is having other commissioners are helping guide the work on other boards and committees that we're not on.
Sure. No, I understand that, and I appreciate that very much. I am in favor of Dave because of his experience, his expertise, his knowledge, his relationships that he's built within the health department and outside the external relationships. And I think in this time of, we've had a lot of uncertainty with this, with the health department over the last year. And I think going forward, even if it's only for another 6 months, we need that. We need that leadership more probably now than ever. And I appreciate the work that you've done. And we haven't always agreed. I mean, I'll have to be really honest. We had some blowouts, but we respect each other, and I respected diverse opinions and perspectives, and just really feel like right now it's critical that we have continuity and we give him this opportunity. Thank you. Hunter?
I'll just add that Dave does have me on giving vaccines and shots, but I do know CPR, and I have 3 little kids, so I know how to treat a fever quite effectively. So I just wanted to make sure that was part of your consideration as well.
Commissioner Geithner?
Yeah, I mean, since we've put it all out there, and I'm going to be frank, I will not be supporting Dave's reappointment to this board. There have been some really frustrations with the interaction with our staff, and I, as a member of the appointing authority, would ask for you to consider that and follow the commissioner of the appointing authority's recommendation here and elect Hunter.
Okay. Any other comments or questions? I guess it's time for a vote if there are no other questions or comments. So we'll just do a voice. I'm sorry.
Just a procedural question. Can I recommend that we actually write on pieces of paper, because going forward, it could cause divisiveness. That's true. I don't know. I'm just wondering.
Well, Ms. President, I think, would there be a motion to secret ballot, or how does
Lori,
that work?
yeah. Let's let our attorney help us here.
I guess we do have someone online, and so I don't know how that would work, unless if, yeah.
Oh, may I step in and make a comment on that? I think that, yes, it would feel more comfortable to have a secret ballot, but I actually think that we should do a voice vote, because we should not be worried about divisiveness on this board, dependent on how we vote. I think that our strength is in our diversity of opinions and our willingness to speak frankly about it. And I think that the hit to public health that has occurred in the last 4 to 5 years has happened because of the perception, and probably rightly so, that certain decisions made at the policy level were politicized. And the antidote to politicization is not more politicization. And so I think that we should have our diverse opinions, have a reason to back them up, and then be comfortable on the board with sharing those opinions.
Okay, I am fully comfortable being very open about where I stand. I was just trying to be considerate of the candidates, and whoever ends up being the president now will know who didn't support them, and so I just thought that might cause some tension going forward. And I served on the school board previously, and that's how we did it, was we wrote on pieces of paper and the board secretary went and counted the votes. So I was just going off of my experience. I'm not trying to shy away from the decision or politicize anything. I just thought it might help be respectful of the candidates. But however the board wants to handle it, I'm fine.
Okay,
Yeah,
Lori? Excuse me.
Well, if I could, I'm fully comfortable. It's just people just, in the past on the Board of Health, we vote individually, verbally. We never try to do it by ballots. And, you know, hey, I was a regular member before, I can be a regular member again. There's no problem there. I'm not gonna change anything.
Lori?
Okay. State law does allow you to vote by secret ballot when it comes to electing your leadership. From what I can see, your bylaws are silent on that. So my recommendation would be then that if there is a desire to vote by secret ballot, that perhaps there be a motion and a second and the body vote on whether to vote by secret ballot. And if that is the prevailing method, then we can work with Mr. Nixon to capture his vote on a piece of paper, which could then be handed to the secretary.
Mr. Dixon.
Dixon, sorry.
Yes, I'm sorry. Okay. So there's a way to move
yeah,
around this.
I'm sure we could figure out something.
So anyone want to make a motion either way? I mean, I'm comfortable doing a voice vote. I think we're all adults and we're all respectful. I mean, we're all in this right for the right reasons. Yeah. Okay. So, okay, I guess I'll say all in favor of Dave Donaldson.
Could we not do it that way? Because it's hard to count. Could we do it individually, please?
Rick Vu, I'll vote for Dave because I know Dave longer. Dave's been on the board for longer.
Courtney Zalt, I vote for Hunter Barnett.
Commissioner Carrie Geithner, I vote for Hunter Barnett.
Hunter Barnett, I will vote for myself.
Doris Ralston, I vote for Dave.
And I'll vote for myself.
Deborah Chan, I guess I can't really nominate him and not vote for him, so
You're stuck
I'm
now.
voting for Dave.
Commissioner Nelson, I vote for Hunter Barnett.
Mr. Dixon?
Okay, so this is an interesting dilemma. We have two good candidates. I think both of them could easily do the job. Of course, I try to be analytical as much as possible, and what I'm seeing with the need for the board, actually for the health department itself, is I'm seeing possibly more of a need for someone who might be stronger in the business and administrative side of things. If we were at least at this point in time, to me, Dave has more of he's kind of more stronger in the maybe what I call the humanitarian side of things, but I believe Hunter is a little stronger in the business and administrative side of things, and so my vote would go for Hunter.
Thank you so much. So it looks like Hunter will be our new president, and it's a 5-4 vote. Okay, is everybody comfortable with that? Okay, thank you. Thank you.
Okay, thank you, Vice President Ralston. Congratulations, Hunter Barnett.
Thank you, Dave.
You bet.
And for everyone, thank you.
All right, let me put my glasses back on so I can read now. All right, so next up is Vice President, so I think I'll open it up for nominations for Vice President. Unless we don't want to have a Vice President, nobody nominate. Go ahead.
I would like to nominate Courtney Salt. In her day job, she has a lot of experience with supporting boards and committees and members of boards and committees and just helping them to be successful. And I think she would bring a lot to the table in helping our board determine our scope of work. And, that's through agenda setting and what we want to be focused on and making sure that our efforts are really impactful for our community. So I'd like to nominate Courtney.
Okay, so
I don't think we
nomination for
technically need
Courtney.
seconds for nominations, but I'll second.
Any other nominations?
Dave, would you accept the nomination for Vice President? So we have some balance between the relationship and the medicine side versus the financial side?
Okay, I'll do that. I'll accept a nomination for Vice President. Thank you, Miss or Vice President Ralston. Thank you. Oh yeah, I'm running this one. Okay, so any other nominations? If not, we'll close the nominations and we'll allow the two nominees to speak, and pretty much for 3 minutes. But go ahead.
Well, I
Board
will
Member
not take
Salt.
3 minutes. I'm a fan
Very
of
good.
brevity.
Very good.
I just want to say thank you, Commissioner Nelson and Commissioner Geithner, for your vote of confidence and for nominating me for this position. As Commissioner Nelson mentioned, I serve in my professional capacity. I serve helping public boards across the country in their efficiency and their goals, and communicating well is important. And I'm really excited about Mr. Barnett being our next president, and I would love the opportunity to support him with my skills of organization and planning. I've already kind of brought some of that to the table, kind of out of the gate, and in the last few months that I've been here, I have actively gone to public health to meet employees and to support the efforts of our administration, and I have dove headfirst into understanding not just our work, but what are we actually overseeing, and how does this impact the day-to-day operations of this very important department? And so I would appreciate your vote to support me in this role. Thank you.
Oh, yeah, thank you. And really, everything I said last time, just roll it into this one. Here, I guess the idea of continuity, someone who's been here for 4 years, is a big part of what I would bring as the vice president to help Hunter. And just, everything I touched on last time, the medical side of it, the community relations, the rapport with staff and leadership team. And so with that, I would ask for your support.
I have a question for Ms. Salt. Can you elaborate a little bit on your interest in health and why you even want to be on this board?
Yes. Personally, health is incredibly important to me. It's something that I have been an advocate of public health and personal responsibility for several years, including testifying at the legislature on various bills, but also in my personal life, I spend a lot of time learning as much as I can. I am not a doctor, but thankfully the commissioners do not appoint the people who are caring for us, because we like to be able to decide who our own care providers are, but I am very passionate about it, and it's a conversation we have at my home all the time. It's a conversation I have with my friend group. It's something that I'm always interested in learning, because without good health, like, you have one wish, and if you have good health, you have a ton of wishes. And so our move towards chronic disease is something I'm passionate about. Something that I really care about is making sure that we do ensure the health of our community.
And Courtney, can you tell us what sector you're representing here on the Board of Health?
Community at large, just regular citizen.
Wait, can you clarify something you said about thankfully we don't appoint the people who just, I didn't quite follow.
This is not a board that practices. We're not practicing physicians from this role, right?
We have a few.
We have them, but they are not from this role practicing. And so, we all get to weigh in the governance of this department, but we hire the experts to actually do the job day to day.
Got it. Thank you. I didn't quite follow what you meant there.
I didn't have my thing on.
Yeah, I'm just going to comment as well. I appreciate that Commissioner Nelson nominated Courtney Salt. I have known Courtney for a few years and watched her work with boards. I think, respectfully, there's important medical knowledge needed on this board, but maybe elaborating a little on Courtney. This is a governance board, and that's the really important role here, is to make sure we are governing well. I actually think that we can do better than what we have done, and that's not a particular criticism. Really more of what I'm saying is we can be more efficient, we can accomplish more, we can communicate better. I think we're on some of the right track to do that, but there have been quite a few things that I really do think someone who has a lot of experience working and organizing boards, getting them to move together in the right direction planning, really becoming effective at agenda setting and utilizing our time well as a board is something that is really valuable to bring. I know how important it is on my board. It really does make a difference, and I think that she brings a lot of that knowledge that will help us get there.
And I would like to make a comment that boards are policy. Most of the time, they're dealing with policy and not micromanaging, and I think you have to trust your staff and work with them and not try and tell them how to do their job.
I'd like to weigh in also in the difference between clinical and population health and why policy is so important. Obviously, policy drives programs, and programs are the ones that result in whether there is good population health or not. I'm sure you guys have all heard the mission statement, saving lives, millions at a time. And that's the difference between clinical and population health. As physicians, we only treat one person at a time. If we make a mistake, that one person suffers. But the unfortunate corollary to the mission statement of saving lives millions at a time, El Paso County isn't millions, but if we make a policy misstep, as we saw during the COVID pandemic, it impacts people population-wide. And those impacts are can certainly be much more severe than one person being injured in a clinical setting. So I think that we really have to keep in mind how important a knowledge base is in regards to actual medical, clinical, and population health.
Thank you. Any other questions or comments? Okay. We'll go ahead.
Okay, I do have a question
yes.
from the field here. Question of the existing vice president. Have you had a lot of involvement outside of maybe potentially having to run the meetings?
I've served for 7 years now, and I work for a nonprofit, the Colorado Springs Osteopathic Foundation. I'm in the process of retiring. I retire at the end of this month. After I've worked, with the American Heart Association, the American Lung Association, a whole host of nonprofits. I work with physicians, lay people, and so I've been in the community since the early 1980s, off and on. My husband was active duty Air Force. I'm a widow. I have one son who's a firefighter, paramedic here in Colorado Springs. I don't exactly know what you're asking me. I kind of don't understand if I'm answering your question or not. But
yeah, I
didn't
ask the question very.
Vice president, and because I don't even know if I'm going to be on the board because I haven't been told yet. And I know that Commissioner Geithner said that they were working on making sure that there was consistency among their boards, the county boards, to make sure that the appointees were, because I'm retiring, I don't know if I can stay on the board, is really what I'm saying.
Yeah. Okay, so I didn't ask the question very clearly. I apologize. It's more related to a level of involvement in the vice president role with the board. In other words, are you having to have meetings outside, or board meetings, or is it mainly just coming to is the role more along the lines of running the meetings in the absence of the president?
No, I meet with Dave and Deanne and her deputy director. We meet to talk about the agenda and issues, and we meet in between one-on-one, whether it's phone calls or in-person meetings, that kind of thing. Yeah, there is some time that has to be committed.
Okay, and again, I apologize. I didn't ask the question very well initially, so thank you.
All right. Anyone else? Then I think we should just repeat our last process, and we'll start off with Dr. Vu.
I'd like to vote for Courtney. I think Courtney and Hunter would make a good team.
Courtney Zelt, I vote for myself.
Commissioner Carrie Geithner, I vote for Courtney Salt.
Hunter Barnett, I will vote for Courtney Salt.
Doris Ralston, I vote for Dave.
And I'll vote for myself, Dave Donaldson.
Okay, I guess I'll vote, I think I'm going to vote for Dave at this time.
Laura Nelson, I vote for Courtney Salt.
Mayor Dixon. Mayor Dixon.
Yeah,
Your
I was counting. Again, I'm gonna vote for Courtney because I think we're needing the health department itself is needing to look at a more business and administrative side of things, at least at this point in time.
Thank you.
Okay, and that's, by my counting, that's a 6-3 vote for Courtney Salt, with a 3 for Donaldson being Donaldson himself, Vice President Ralston, and Dr. Chan. All right, then we'll move on to the next item, and I would like to say congratulations to Board Member Salt.
Thank you so much.
Congratulations to both of you.
Yep, and I'd like to say thank you to Vice President Ralston for all of your help and assistance over these 9 months, and to the previous 2 presidents, I believe. So, and your commitment to public health here and the organization is clear. So thank you very much. Okay. All right, we'll move on to the next thing, which is there's one person who's not going to get out of their duties today, and that is going to be the appointment of the Public Health Interim Executive Director as the Secretary, which is kind of what we've always done. The Executive Director becomes the Secretary. Could I receive a motion and a second for that?
So moved.
And I'll second.
Okay, so we have a motion by Commissioner Geithner and a second by incoming President Barnett. And any discussion about that? All those in favor, please say aye.
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 Any
Aye.
opposed? Okay, and we'll count that as a 9-0 vote in the positive. And next is a renewal of the CSC sublease agreement. And I believe Lauren Mearmont is back on the hot spot for this one. Well, the microphone, the podium.
So we received our renewal agreement from the county yesterday, so those hard copies are printed at your desks. I don't have a lot to share or say about this. It's a renewal of an ongoing existing agreement between public health and the county to lease the space that you're in for rent and common area maintenance. There's a slight increase in cost over previous years, about $30,000. But otherwise, just a renewal of our existing agreement.
Okay. Any questions for, yes, go ahead, Dr. Vu.
I guess this question is more, man, my voice. I guess it's more for Lori. Lori, I don't remember taking action on this sublease every year previously. So my questions are, number one, is it really a decision at the board level as an action, or is it more at the executive director level to make that decision? Number two, if someone can clarify to me the language of the CAM, is the CAM a flat fee on this lease, and then, or is it something that's reconciled after the term of the lease?
I do think it is appropriate for the board to take a motion and act on renewal of the lease. I can't speak to why it hasn't been done in the past, but I can certainly look into that if you'd like. The party to the lease is El Paso County Public Health. It is not the Board of Health, but just like all of the contracts that we enter into, El Paso County Public Health is the contracting party, but as the Board of Health, you nonetheless vote to approve those. So it would be a similar situation here. And I'm sorry, I didn't catch, if you could repeat your question about the CAM charges. I
The
didn't catch
language of
it.
the CAM, is it a flat fee or is it reconciled?
Well, pursuant to the terms of the agreement, and I don't know if Lauren would have a better answer, it's a flat fee, it's based on its square footage, and so it is a flat fee that's divided into monthly installments pursuant to the
Can I have a
lease.
follow-up question then? Then I do remember that we also have other subleases, or at least one that we are the sub-landlord for.
Correct, correct, down at
So
Public Health
why are
South.
those renewals not at the board level?
The renewal for Fountain?
Whatever others.
So, yes, the lease that we have with Fountain to utilize space in Public Health South was written in as an auto renewal unless notice has been given. So that is an auto renewal,
Okay, thank you. Any other sublease of these agreements that we have?
only with Fountain.
Thank you.
And Lori, we have voted on this in the past every year.
Thank you.
Thank you. Yep.
Okay.
Apologize, my memory's not good.
Any other questions for Lauren? Okay, if not, then I'd ask for a motion to approve, I guess, the renewal of the lease, sublease.
So moved.
So moved.
Okay, we're gonna give that one to Vice President Ralston as the motion. Would you like to second that one?
Sure, happy to
Okay,
second.
Okay, and then second by Commissioner Geithner. And if there's no further discussion, I'm even looking up on the screen for Mayor Dixon. He looks content. Then we will,
Thank you.
all those in favor, please say aye.
Aye.
Any
Aye.
opposed? All right, so that one passes, well, 8-0 with, we'll go 8-0, unanimous. And now, that concludes the open portion of our session today, our meeting today. And what we'll have to do now is we'll have the room prepared for a closed executive session. I guess we should vote first whether or not to go into closed executive session. And I'll kind of hand this over to Lori to kind of read us into closed executive session.
Thank you. So there is an executive session request pursuant to CRS 24-64024F regarding personnel matters pertaining to the annual performance review for interim public health director, Executive Director Deanne Ryberg. There does need to be a motion to go into executive session and a vote. We do need a 2/3 majority to vote to go into executive session per state law. And just for your information, at that time, Nate Whitney will be taking over for me, and he will lead you through the executive session process after that.
Okay, very good. So with that, I would ask for a motion to go into closed executive session.
So moved.
So we have a motion by Commissioner Geithner. Is there a second?
Second.
Second by incoming Vice President Salt. And so that's our motion and second. All those in favor, I guess we need to read this off by name, right? Roll call? Is that right, Lori? By roll call?
That would be my recommendation so that we can make sure we have a
Okay, Dr.
accurate
Vu?
count.
Aye.
And Courtney Salt?
Aye.
Commissioner Geithner?
Aye.
Hunter?
Aye.
Vice President
Aye.
Ralston? Okay, I also vote aye. Dr. Chan?
Aye.
Commissioner Nelson?
Aye.
And Mayor Dixon, online.
Aye. Aye.
Okay, so big unanimous, 9-0 on that. So with that, I think we should take probably a 5 to 10 minute break. If you can do what you need to, but hang in the room. Once the audio visual is ready, we'll do it. Thank you.